Welcome to another one of our Sustained by Grace Ministries and Outreach program, where we seek to nurture you back to wholeness and life. Today we are focusing our attention on dental health. Yes, your dental health and you. The danger of poor oral health. It is our facial system that enables us to speak, chew, and smile. Today promised to be another informative and interesting one, and we have in our midst Dr. Shawnette Finnegan Bailey. Dr. Shawnette Finnegan Bailey has been a dental surgeon for 17 years, working for at least 15 years in the government health center, providing oral health care in the parishes of St. Catherine and Kingston. She has worked as a public health specialist coordinating oral health program in KSA Health Department. Dr. Finnegan Bailey shares her passion of dentistry outside the health center and her private practice, giving many oral health talk at schools and churches to improve oral health care awareness with the hope of ultimately changing the knowledge, the attitudes, and perceptions toward oral health care and the noble profession dentistry, and occasionally providing clinical support at health fairs and churches. Dr. Finnegan Bailey, welcome. Happy to have you with us today.
Thank you very much. Thank you so much for such an introduction, and thank you for the privilege to share with you this evening.
Right.
So as you said, I'm here to speak about oral health, and I just wanted to put a little spin on it. And
Yes.
ultimately, we will describe that which you have asked, reconnecting your mouth to the rest of your body, the
Okay.
oral health connection. You know, a lot of times people do everything. They want to save their eyes. They would want to save all the other organs. But when it comes to the mouth, the teeth, they don't think twice to say, yes, get rid of it. So I'm just trying to show you ultimately that it's just as important as the rest of our body.
Thank you very much.
Yes.
Welcome and happy to have you. You can
Yes.
go right ahead with your presentation, reconnecting your mouth to the rest of your body. So let's not
That's good.
disconnect.
Exactly.
Let's reconnect.
Exactly. Yes. So we will put the same emphasis on it. So the question is asked, can poor dental health harm your health? Just a second, please.
No problem.
Okay. Right. Was in my screen. So here I have an edition of the Time magazine, The Secret Killer. The surprising link between inflammation and heart attacks, cancers, Alzheimer's, and other disease. What can you do to fight it? And that is why I want to spend a little time through this presentation to explain the importance of good oral health, demonstrate the vital link between oral health and general health, discuss various risk factors that are common to oral diseases and systemic diseases, and of course, learn new ways to maintain good oral health. So let's get down into what is oral health. And I'm using the FDI, that's the Federal Dentistry International definition. It's on their website. It's basically includes the ability to speak, to smile, smell, taste, touch, chew, swallow, and convey a range of emotions through facial expression. And you do so with confidence, without pain, discomfort, and disease. That's the basic understanding of oral health. It also exists along a continuum influenced by values and attitudes of peoples and communities. It reflects the physiological, social, psychological attributes that are essential to the quality of life. It is influenced by persons' changing experience, perceptions, expectations, and ability to adapt to certain circumstances. So, I mean, sometimes based on your background, you might not place certain emphasis. Sometimes in some communities and cultural groups, we might not play the emphasis, but you want, through education, through different experiences. There are parents that will tell you when they were younger, they wish they knew more about oral health. Now they have their own children. They are trying to change the dynamics for them. So it has a range of dynamics to oral health. So why is oral hygiene important? First of all, your mouth is the gateway to your body's digestive and respiratory system. And in your mouth, there are certain microorganisms that are present and they cause diseases. The most common diseases that we are aware of in our day-to-day life: tooth decay, what we may call rotten teeth, caries, bad breath, or the scientific name halitosis, and gum diseases, starting out at gingivitis, and as it progressed to periodontitis. So without proper oral hygiene, the bacteria that's in our mouth, it can reach certain levels that lead to these oral diseases. And as we talk about the link and the connection, we'll see also systemic problems. So oral health is just as important, and it contributes to your overall health. It's evidence-based that the health of your mouth mirrors the condition of your body as a whole. For example, when your mouth is healthy, chances are your overall health is good. Research also shows that good oral health may actually prevent certain diseases from occurring. And in some cases, oral problems can be a symptom of other diseases such as diabetes. Research also has shown a link, some association between gum disease to heart disease, premature birth, dementia, even knee arthritis. There has been some connection that is shown through research over the years. So we're going to look closely at risk factors. Risk factors for oral health. And risk factors, you will notice, it's the same risk factors as some of the general diseases that we talk about as we move towards living a healthy lifestyle. So a risk factor is something basically that puts you at risk or allow you to be more likely to get the disease. So let's look in the middle of my diagram where we look at common risk factors. And tobacco, for example, I know we might be familiar some years ago that the ministry had a tobacco cessation campaign because tobacco was known as one of the risk factors for cancers and heart disease, two major killers even in Jamaica. And as you look at tobacco, it also can cause you to have periodontal diseases, which we call gum diseases, and oral cancer. Just look at the blue arrows, you realize it's the same thing. So when you decide not to smoke, you're not only improving your general health, we are saying that you're also improving your oral health. Likely for alcohol, we are encouraged right out there in the media through different spaces, socially and otherwise, to reduce alcohol consumption because it's bad for your health. It's also bad for your oral health because it's like it predisposes you to get gum diseases and oral cancer. Now, what is the biggest campaign that we are having now, especially even in our country, is the one for sugary drinks, to have less sugary drinks, and we are encouraged to have more water. So when we talk about poor diet, a diet which has very little vegetables, very little fruits, but it's filled with a lot of carbohydrates, and especially for our children that love to eat the sweets, the chocolates, the bag juice, those things, it's not good for your health, too much of it, I should say, because it can cause diabetes, some cancers, heart disease. And we're saying it's the same sugary stuff that causes children to get caries, adults, even cancers and gum disease. So it's just as important. So we want you to put things into that perspective as we're moving to be more health conscious. So we're going to look at, since sugary diet that causes us to have diabetes and those things. That's something that people relate to. And it predisposes you to get caries, cavities, rotten teeth, whichever of those words that you are more familiar with. Let us look at what the caries look like. So I'm putting up a picture there. And I put this because sometimes we look in our mouth, we might not be feeling anything, but we observe a change. It's usually nice and white, and then all of a sudden you see these little black spots inside of it. This is telling us that we have cavities. So before things get out of hand and we lose a day from work, or our child lose a day from school, and other complications happen, we wanted to, do what needs to be done to get it sorted out. So let's shed a little light on cavities. So as I was saying before, I'm explaining this. It might look complicated, but it's simply saying that as you feed on the sugary stuff, the glucose inside those foods, it meets with that bacteria that I tell you lives in your mouth, and it causes acids to be formed in your mouth. And those acids, you leave it on your mouth, you don't brush your teeth, you don't do what you need to do. It first starts with a little hole, and then you may find that you eat something sweet and you feel a little cramping, but it doesn't bother you. You continue with your life, and you don't pay it any mind. Then you might notice every time I drink something cold, every time I drink something warm, I'm feeling a sharp pain. Then unfortunately, this is when we start seeing some of our patients, when it probably reaches close to the nerve of the tooth, or it becomes exposed. They can't sleep all night. They're having pain while eating, and their routine it's somewhat disrupted. Then we might say, okay, it's time to do something about it. But I'm hoping after this and your understanding improved, you'll take a different approach. So as I said, the caries are as you look at these faces, this is something you see sometimes happening, to the people that we love and know. Look in our children's mouth. They're not supposed to have these black holes inside of them as demonstrated on the screen. This is sign of cavities, and you want to address it before your child can't sleep, can't eat because of the pain and discomfort, the negative result that happens because of caries.
Dr. Finnegan,
yes, go ahead. Ask your question.
What's the first thing in taking care of their teeth, or our teeth? What's the first thing that we should do? I know that we should go to the dentist at least twice per year, but the everyday care to prevent the caries and the tooth from rotting. What can they do?
The first thing, as I had mentioned earlier, I would have gone into the other things later in the presentation. Okay. But the first thing, as I said, is your diet, the foods that you eat.
Okay.
Most of the things that we tend to consume because we like them, they're filled with sugar. And that sugar sits on your teeth. It stays there morning, noon, and night. It stays as long as you take the time to brush your teeth. So one of the things you can do is brush your teeth after your meals, because in brushing your teeth, you're removing that sugar from your teeth. So the germs that live in your mouth, they don't have any food to eat. Okay. That's simply put it. So the cavities cannot start. These holes cannot start because there is no food for the bacteria to feed on.
So
that's
brush
the first thing.
As you eat.
Brush as often as you eat. So there is a saying that it might not be practical to brush as often as you eat, because some of us have bad eating habits. We're eating all the time. We don't stick to 3 main meals. When you stick to 3 main meals, your breakfast, your lunch, your dinner, then, at least for your breakfast, you're still at home, you can brush your teeth. And when you eat your dinner, hopefully you're at home, you should be able to brush your teeth. So If we're snacking on the time, your children snacking on the banana chips and the cheese sticks, and then the sip, drinking all day. You see them running up and down with this one box of juice. It's sugar, and the bacteria feeding on it all the time.
So we need to have that discipline, eating
that
discipline.
discipline. So right, when yes, you're preventing yourself from getting diabetes. We understand that, everybody knows that now, but we are also saying the same discipline contributes to having a better oral health. Stick to your meals. And I mean, even if children, they love the little ice cream and they love little cake, because birthday party, for example. But after all of that, make sure you brush your teeth. That's one of the basic things that you can do to maintain health, because at least it prevents these graphic pictures we're looking at, tooth decay.
Very graphic.
Yes. And sad to say, it is this graphic, and still some persons don't do anything about it if it doesn't hurt. Because it doesn't hurt. The thinking is when it hurts, that's when you start to do something about it. But that's too late most times. So you want to preserve your teeth, because as I mentioned earlier in starting, you smile, you socialize. You can go to an interview, speak confidently. It contributes to your whole well-being.
Yes,
so we have to put it in that perspective. So in addition to what I just said to you about the brushing, the foundation thing, that's cost effective. And that's why we should put emphasis in brushing. We have something that we can do at the office, and I'm going to talk about it on my next slide, where we say preventing caries. So in addition to what I'm saying, sometimes when you look on the teeth, I'm not sure if you're able to see my cursor pointing on the first, right. There, if you look, you notice you see like a little crack in the tooth, like a little groove, right. Food gets stuck in there. So just thinking you're enjoying a toffee, a little girl or a little boy eating toffee, and food gets stuck inside of that the whole day until mommy forces them in the night to brush their teeth. The cavities start. You can process that, right? So we have something called a sealant that you can put, and that's the next photo on the right. You put it in the tooth. So now you don't see any cracks. So even if they eat, and even if they forget to brush, that tooth shouldn't get a cavity.
So that is permanent or temporary?
That is permanent. It is permanent. For the most part, it is permanent. And what we do is check on it 6 months, 9 months, 1 year. At least if you are someone that we see frequently, twice per year, we'll check on it to ensure that it's still there. Just if by chance it falls out for whatever reason. But it's very, very effective in preventing the cavity. Now on the right side, I am showing you when you have it, some persons may say they don't like to fill their teeth, but the truth is, if you fill your teeth, and that's the filling on the right side, we have the white fillings now in case you don't want to see the black ones. That's not very attractive. We have the white fillings that can be placed there so that you don't have any problems with the tooth. The tooth is still there serving the function it's supposed to serve. All right, so I just wanted to increase some awareness in that, because a lot of people thinking about health. So as it relates to oral health, this is how you can improve your oral health. All right. Okay, so the next disease that I mentioned earlier that is very popular in our society is the one called periodontal disease. That's the fancy name, or gum diseases, which is very frequent even on the ads on the TV. So it's really periodontal disease is really a chronic inflammatory disease that's caused by, the plaque that's in our teeth. Sometimes if you look at the bottom picture, you can see some little yellow whitish growth on the teeth. That's what we call plaque. So the bacteria lives inside the plaque right there under the gums until it grows to the top of the teeth, and that's what we are seeing on the surface of the teeth. This is what is called gum disease, and it causes the gums to swell, it causes the gums to bleed. So sometimes people say they're brushing their teeth and they see a lot of blood in the sink, or they might be sleeping and they wake up, saliva is on their pillows and they see blood inside of it. This is an indication to you that your gums are not healthy and you need to visit your dentist. Now, before I get into that, I'm just graphically showing you this is what happens underneath your gums. So in the first diagram, you don't see much. You don't see any redness or anything. That is what a healthy gums look like. But the next one, B, if you look in the person's mouth, you may observe the gums looking a little red right around the gum of your teeth. So sometimes you're looking, it might not be bleeding yet when you're brushing too much, but you're looking and it say, oh, it's looking a little red. You, the individual, realize something is wrong. If you look at C underneath, that food, the plaque that I was showing you, that reaches the surface, you see it build up so much under your gums till it reaches the top of your teeth. And not only are your gums red, but even the bone right around the teeth that's supposed to provide support to your teeth, all of that is getting inflamed just because of the germs that live on your teeth. And all of that is happening underneath. So sometimes you don't realize that this is what is happening underneath because you can't see it. When you smile, you're not seeing that this is happening. But slowly you're losing bone and the gum that's supposed to stick to your teeth, it's separating, and that is shown in D. Now look at the smile of the person's mouth in picture D, where they lose bone, they're losing the gums and all of that. You see how graphic, and some person may say, oh, this is looking so bad, right? You actually can see the plaque on their teeth. You see it? And you see,
Yes.
it's just not looking nice and pretty. Look from the comparison A and D. So when you look at your smile and you're observing it's changing, you must say to yourself, it's time for me to go. I'm seeing the bleeding and I can actually see the food on my teeth, the stains and all of that. I need to go, right?
Because this is a point. Sorry, doctor.
Go
This is
ahead,
a
go
point
ahead.
where they cannot help themselves anymore.
No,
They need
brushing
to
and
go.
stuff. Exactly. Because to get some kind of restoration to the health, all of this thing underneath it, that yellow thing, because the toothbrush don't go underneath here, you know, because this is under the gums where I'm pointing. It's underneath that yellow thing on the teeth. All of that. We know the dentist has to go underneath there and clean off everything just so that it's healthy. And the gums hopefully will stop bleeding and all of that. So it's just to have some appreciation that is not the dentist want to charge you money or a whole heap of money, but it's because you can't see. You don't realize all of this is happening. So I just wanted to share this so we can appreciate the conversation that you may have with your dentist.
And barring that, they will eventually lose the teeth if they don't go and fix it.
You'll eventually lose it because look at this now graphically. In point A, this is where the bone is at the top, right to the neck of the tooth. I don't know, you see my arrow, right? My cursor, can you see? As I was saying, the cursor is right at the neck. This is where the bone is. In the picture of D, where you actually see the teeth and you see below the teeth, this is where the bone now reaches half. So if you have lost half of your bone structure, then that's where it starts shaking. So persons will tell you, oh, my teeth, it wasn't hurting or nothing, it just shake. And they end up losing it because the bone structure is so damaged just because they did not act in time. So brushing at home is important, but brushing at the dentist is just as important because we are able to get underneath the areas that you can't see, removing the food and removing the bacteria, the place where the bacteria would live. All right. So now we have an idea what periodontal disease is. And as I mentioned, this is where the link is, the bacteria getting into your bloodstream. So when that bacteria gets into your bloodstream, this is some of the risk that is associated with periodontal disease. Diabetes, cardiovascular disease, even adverse pregnancy outcome. Adverse in the sense that we may have preterm labor a little earlier than what is probably expected. And of course, pulmonary or lung diseases. So studies have shown that there is a two-way street between gum disease and diabetes. And persons who are diabetic are 2 times more likely to get gum diseases. All right. And the reason for that is, as I said, the bacteria that lives under the gums, right? It causes a immunoinflammatory response. That means it causes some kind of reaction where your immune system will have to try and deal with the bacteria that's in your gum. It's the same kind of response that causes the gum disease, is the same response that causes insulin resistance for the type 2 diabetic patients. So there is a very good response. Studies have shown where if you keep your oral health at optimum, it helps to control your diabetes. And this is out of what I just explained. So the third thing, we spoke about caries or cavities. We spoke about periodontal disease. And the third thing I'm going to talk about is halitosis, or what we call bad breath. All right. So some of the common causes of bad breath is also from the certain types of food that you eat. Sometimes you take certain medication, your hypertensive medications that causes your mouth to dry out, or even some cough syrups, your mouth feel really dry after you take them. Then that causes your breath to smell. And most persons are aware of waking up in the morning and you have that initial bad breath. Excuse me. But the thing about it is that if you look at my little diagram here, it speaks to plaque buildup, the same plaque that causes the gum disease. This plaque that is formed by saliva and food sticking on your teeth, right? You don't floss your teeth, you don't brush your teeth, that buildup, that is what causing the bad breath. So sometimes you have bad breath, and just by getting your teeth clean, removing the food on the top of the teeth and under your gums, you find that your breath improves. There might be challenges if you have, for example, other things like sinusitis, where you might have a draining. The cleaning alone would not address it completely. You would have to address the sinus issues. But sometimes diabetics have not diabetics, persons with kidney problems may have like a fruity smell. That smell, that not too pleasant sometimes, that is an indication to us that you might be having other issues that are not dentally related. So we're still talking about why you need to brush, why you need to floss, why you need to visit your dentist to remove all these foods that can cause these major diseases. All right. Sorry. So neglecting dental care can lead to bad breath. All right. So you might see an unusual coating on the tongue from the buildup, as I explained, of plaque on your teeth, that early morning breath. You may experience a bitter metallic taste in your mouth, or you may have that post-nasal drip, usually from persons with sinus issues. They are the ones that tend to have bad breath. But how do you take control of it? It's the same message right throughout. Just 1 or 2 tweaks depending on which one of the diseases that you have. Brush your teeth with fluoride toothpaste at least twice a day, And when it's twice a day, that's usually after breakfast and just before bed. Those are the two main times. And brushing the teeth is something that takes time. It takes 2 minutes so that you can clean all the areas, all the teeth of your mouth. Now, children love to taste the toothpaste and just swallow and spit out. We as parents, we may have to give them a little stop clock at the beginning until they have an idea how long is 2 minutes and how long it takes to brush. Another thing that is encouraged is cleaning your tongue, because that unusual white coating that we were speaking about, if we had a tongue scraper, we could have scraped it off. And if you don't have that, you can just use your toothbrush to brush your tongue at least once per day. And that once per day, I recommend is usually best just before bed. You floss your teeth, you rinse out your mouth with a mouthwash after brushing, and we have a little care on toothbrushing. The toothbrush is usually changed every 3 months, but sometimes you might have to change it before 3 months. When you notice the bristles on the toothbrush have separated, or you may have a cold or something or a virus, something like the flu, you would need to change your toothbrush again after you have gotten better from the flu to ensure that you don't reinfect yourself. Another thing we can do to take care of bad breath. There are some patients, they may not have teeth, they wear full dentures, but it is just as important for them to wash through their mouth, clean their dentures, and they visit their dentist from time to time to ensure that their dentures are fitting properly. If you're wearing those dentures and you're not brushing them, the food and everything will dry on it, and it will cause the bad smell from your mouth.
So that white coating on the tongue, is it bacteria?
Sometimes it's your saliva. Yes, your mouth probably so dry that it's starting to cake up a little bit on your tongue. So the germs that we can't see will get stuck in those areas. So scrape it off or brush it off.
Okay.
Mm-hmm. All right, so that was something even for our elderly patients that may wear dentures. Don't think you don't have any teeth, so this job is over with oral health. It's just as important because you need to brush those dentures. Do not sleep in them. Take them out in the nights and leave them in nice, clean, fresh baking soda, water, or there are commercial products that you can buy to keep them clean and fresh. So when they speak, the same fresh breath comes from their mouth. All right. The other disease that is very popular is oral cancer. Now, when people talk about smoking, for example, they may say, oh, you're not afraid to get lung cancer, you just smoke like chimney. Very few persons may say, you don't afraid you get cancer in your mouth. You know, we don't realize it's the same mouth connected to the body. Yes. So just as how you put your lungs at risk, the chimney in this case is the mouth. Yeah. That's where the smoke is. You understand? Mm-hmm. So definitely you are prone to oral cancer. Smoking and high alcohol consumption, it impairs or it sort of inhibits your immune response and put you at risk to get cancer. So cancer, yes, can occur in the mouth, any part of your mouth. You can have it on your lip, your gums, your tongue, in your cheeks, in the roof of your mouth, under your tongue, all of those places. Cancer can appear in any of those areas. Another reason why it's very important to see your dentist. And and to the right, you'll see some of the things that can cause oral cancer. Too much in the sun, you can genetically predispose to it. Maybe persons, just like a lot of persons, mothers, auntie may have breast cancer. It's the same thing, right? It could be genetically related. Nevertheless, continuing, It can be caused even from the human papilloma virus, the same thing that causes cervical cancer. It can cause oral cancer as well. And oral cancer is not pretty in the sense that it's one of those things that you get it today and you die very soon after, because sometimes it's not easily diagnosed. So by the time you realize, it's far gone and very little can be done. And even if we can do surgery to remove the area, there are so many things to be done. The quality of life is not the same. So we have to realize that when we're doing the smoking and all of that, you're putting yourself at risk for oral cancer. Now look at these big tumors in your mouth. And look at the right one on the side of your tongue. It can be anywhere, as I said. So you yourself can inspect your mouth. Look in there and see if you see a little cut on your tongue that just doesn't seem to be getting better. It just taking on different shapes. See your dentist so we can have further screening. So just like other cancers, you have breast cancer month, and they will say get your mammograms, or they may say get your pap smears done. We also in dentistry say get an oral cancer screening done, because it can save your life. Prevention is better than cure. We will do the inspection to see if there's anything unusual that needs immediate attention, especially if we know you have a history, as I said, of smoking and alcohol consumption. So we also have special equipment that can look in your mouth, because if you look at the top picture to the right, it's called a Velscope. Look in the roof of your mouth. Now looking under the normal light, you don't see anything. But if we were to use the Velscope, you would actually see that there's a lesion here that is cancerous in nature. This one on the tongue, you look at it, this one in normal light, you could see a small little lesion like an ulcer. But when you use the Velscope machine to screen, we are able to see, yes, the person has something on the side of their tongue, and this probably can be surgically removed before it spreads. So screening is important. And this is putting the icing on the cake. When the last slide where I said, oh, what we need to do, this is putting everything into perspective.
The screening that they do, is it done by all dentists, or do you have to go somewhere special to have it done?
Okay, so not all dentists may have a Velscope, which is this machine. It's very expensive, so we may not all have it. But if we observe some of the lesions that can be observed, the machine basically what it does is help you to do the early detection, because even if we couldn't see it with our naked eyes, it will be picked up. So not everybody may have this. We do have like oral surgeons. They are the ones that will do the surgical procedures. They may have such a equipment. So if we observe as a general practitioner something unusual, as I had mentioned, you may have a sore that just does not heal. It keeps getting bigger. You understand me? We might observe it during our screening. Then we would have sent you to get the further checks done at our specialist.
Okay, thank you.
Yes. So wrapping up on the oral systemic connection, as we said earlier, that there is a link in the bacteria that is seen in gum disease that affects diabetes earlier. We're also saying it affects heart disease. There's a link between gum disease, heart disease, and research indicates that gum disease increases the risk of heart disease and stroke. Likewise, people with gum disease are likely to have heart disease. So we need to pay attention to the care of our gums, right? So let's come down to the part that puts it all into perspective. So how to take care. I've been touching on almost everything, but this is just to tighten so we will have something to remember. As I mentioned, brushing, flossing, and I know I have a mouthwash. If you don't have a mouthwash, you can use water. That's fine. And the preferred mouthwash, it is one that says zero, no alcohol, no alcohol. The alcohol in mouthwash is what gives it the harsh feeling, and sometimes it dries out your mouth, right? So you can use the one that says no alcohol. It's less harsh, especially if you have very elderly persons that they can't take these harsh things. So brush and floss as often as you eat. When you're brushing, use a medium or soft bristle toothbrush. So I'm not so much into the brands, like using a soft or medium. The very hard ones damage your gum line, and that is what causes sometimes along the gum of your teeth to get sensitive. When you use the hard wash and you're brushing like this in the horizontal direction, you actually see little craters in the gum line of your teeth, and that's what causes sensitivity. So it's very important that you use the soft. Many times people say it doesn't feel clean, and really it's not in the type of brush, it's in the technique of the brushing. Because if you're not brushing the 2 minutes, as I mentioned earlier, most of us take 30 seconds, then it won't feel clean. If you really spend the time, 2 minutes to ensure all surfaces are brushed, you will feel the clean. Look at that. Brushing your teeth properly is the foundation. I know I stressed it earlier in the presentation when you asked that important question, what can we do? And it is right here too at this stage of my presentation as well. That some level of the acid in your mouth that I spoke about, after you eat, the healthy bacteria in your mouth, it goes down, and that's what works on that enamel. Everybody know the outer layer of your teeth is the enamel, that very hard surface. The acid breaks it down. So brush your teeth using the right teeth technique. Looking at my diagrams, the top teeth, you turn the toothbrush a circular way so all the bristles comes right down. So the top goes downward and the bottom goes upward. So you don't only brush the front that people can see. You brush the sides, you brush the insides, as I have mentioned. You understand? And notice the position that the toothbrush is turned to make it maneuvering of the brush easy, just to ensure that you reach all surfaces of the teeth. And after we have brushed, include the tongue and include the cheeks. Sometimes food is trapped, especially in our older patients when the muscles are not as active and the food, tends to get trapped in the cheeks. You have to brush it out as well. So make sure you brush the cheeks and the tongue.
As you're on that, Dr. Finnegan, what about like the wisdom tooth?
Right. Sometimes it's even hard to get around there. There's some toothbrushes, if you look at them, they have like a pointed tip. Those help with that area. So when you go to the back now, the bristles tend to slide a little bit under that gum area where the wisdom tooth is shooting out. So especially when they are coming out and the gum is tender and very painful, you still try and brush that area, but I would advise a little warm salt water so you don't have as much pain, and anything that is you would have loosened with the toothbrush, that salt water help to flush it out and help the gums. So brush all areas, and that is why sometimes wisdom teeth, you may get cavities on them. It's so far back you don't reach around there. So spend the 2 to 3 minutes so you can reach even the tooth to the extreme back. All right, brushing is the foundation. Brushing is key. So let's look at some pearls about brushing. No matter what you ate, you should always brush your teeth just before bed. Just be sure to rinse your mouth with water to first minimize that acid that's causing enamel damage. Brushing does a world of good for your teeth in the morning, even before you have eaten. This is because you produce less saliva during the night, and saliva is important for keeping your teeth clean and healthy. Having a midnight snack without brushing after is linked to increased tooth loss and tooth decay. So no matter what, be sure to brush your teeth before you sleep. So if I should include also for children, you're trying to let them fall asleep and you put the little bottle in their mouth and they fall asleep with that food on their teeth. That is like a midnight snack, right? So this is why so many of them have those little black spots that we were talking about earlier, because the food is left all night on their teeth. So be careful of this practice of putting in the milk and the little juice to help them to fall asleep, just to make them comfortable and fall asleep. If you have to do that, it's best to give them some water in the bottle. All right. Use fluoride toothpaste, a toothpaste that's no more than 3 months old, and brush for 2 whole minutes twice a day. Brushing and flossing. Clean your teeth prevents potential problems. All right, flossing daily and rinsing with the mouthwash as we mentioned. So we did talk a little bit too about nutrition. I've reduced the sugary snacks, because if you're going to include the sugary snacks, not only you're likely to get diabetes, you'll get the cavities, and most times we are not brushing us at the same rate as we're eating those snacks. So if we can reduce and avoid them all entirely, that would be good. But another one that is important is visiting your dentist regularly. Your dental checkup, at least we would have done that, and we are able to check the health of your oral tissues. We're checking for risk, so we might ask you a few questions. We're checking for diseases that you may have that you're not aware of, like the ones we mentioned, the cavities. Because you can have the cavity and it's not hurting you. We would have seen them early and do all that we need to do to prevent it from progressing. We also check for health complications associated with oral disease, cancers, and ask routine questions. Check on your hygiene habits, because based on what we see, we have an idea of what your habits are like, and steer you onto a more healthy path. So these visits are very important. So I know we spend, we try and put away money for this, put away money for that. At least have one visit for the year, because it's important to your overall health. Don't forget that. All right. You wanted to ask a question?
No. I was thinking about, some person have never been to the dentist. I'm just wondering what they might look like.
Yes. And to be honest, some persons are really genetically blessed. They may not have a cavity because genetically they have very strong teeth. I mean, just like any other, health issue, they have genes that give them that edge. But as we said, you may have oral cancer. You may even be developing diabetes, and we are able to tell you that based on little things we observe. So it's still good to check your health. I mean, move away from waiting until it hurts, because sometimes that's why we are so scared, especially children, 2-year-old, 3-year-old having, toothache. That is very traumatic sometimes for the whole life. So if I should say this, for children, we encourage them even at age 1 just to check if their teeth are developing. I mean, there's nothing unusual in their mouth, and to give them that positive environment where they can see the dentist as a friend and not an enemy. So we promote oral health care dental visits, your frequent dental visits for all ages as early as 1. Because when they start 1, they're starting to eat all kind of things anyway. So come early so we can stop it in the track. All right. So your dentist takes a big role of your dental care. You may have a cavity and it will grow if you don't take care of it and remove it. So your dentist will tell you how to take care, what you're doing wrong, what you're doing right, and how you can modify your whole approach to dental care. So it's a conversation, it's a partnership between you and your dentist. Just a few tips for new moms. Brush your teeth 2 to 3 times a day for 2 minutes. An electric toothbrush may be more effective for you in getting rid of bacteria. Floss at least once a day to reach the plaque that's between your teeth, below your gum line, those areas where the toothbrush can't reach. Rinse your mouth daily, as I said. Include vitamins and minerals. So it's just as important for your general health as your gum health, right? Include adequate supplies of vitamin A, C, and we know calcium, which is strong, good for your teeth, the calcium. The C is also good for your gums. They are vital for both you and your baby. So multivitamins may help. Visit your dentist for a complete exam and professional cleaning, and you try to sleep at least 6 hours a day. Just a few tips, making your health a general response. Nutrition, we mentioned this. So healthy eating is just as critical for oral health. There is a bi-directional relationship between oral health, diet, and nutrition. Diet and nutrition affect the health of the tissues in the mouth, and the health of the mouth affects nutrients consumed. Because if your mouth is not healthy, you're having pain. You can't eat all the foods that you need to give you all the nutrients that you need for your body. So there is that relationship. They work hand in hand. The consumption of sugars, as I said, has been associated with increased risk of developing caries or cavities. And then that's the complex nature of the gum disease or periodontal disease, makes it difficult to determine the relationship with the diet and nutrition. Likewise, frequent consumption of acidic foods and beverages. So we have a lot of persons, they like to drink sports beverages, which are sometimes acidic in nature, and even fruits which are good for us, some of them are acidic in nature. This is associated with the risk of erosive tooth wear. So you have to be careful not to allow this acid in those foods to remain on your teeth too long. So your brushing is very important to minimize the effect of those acidic foods. We have special toothbrushes as well. Not toothbrushes, sorry, toothpaste that can provide, and mouthwashes too. So some of the mouthwashes, when you look on it, it might say antiseptic rinse. I should have brought one with me. I'm so sorry. The limitations of the virtual space. So the mouthwash that says fluoride rinse, it's usually purple. So the ones that I've seen. There are different brands, different companies. So it's very good when you look at the mouthwash, look to see if it says antiseptic rinse or if it says a fluoride rinse. The fluoride rinse, it strengthens the enamel of your teeth. And so if you are somebody that frequently consumes acidic foods and beverages, this will be very useful to your the flossing regime, the brush, flossing, and rinse that regime that people follow. That would be very good to use a mouthwash that has fluoride in it. So let me hope that you would have learned that yes, gum diseases and other oral diseases, some of them share the same risk as some of the medical problems that persons are faced with. And so the same kind of interest we do in terms of eating healthy, eating a balanced diet is just as important for your oral health. Brushing and flossing as often as you eat is very important. And to visit your dentist, we say every 6 months. because that at least anything should develop in that time, we are able to treat and deal with it in a positive way, maintaining your health and ensuring that you have a better quality life. All right. So July is Healthcare Workers Appreciation Month. So I use this time to say thank you to my colleagues, both the dental surgeons, the nurses, doctors, porters, all healthcare workers, whatever category of staff you are, for the role you have played for the last 2 years in our country. We appreciate you, and I want to send appreciation to them as well. And I also want to acknowledge my chief dental surgeon, Dr. Irvin McKenzie, who was very instrumental in helping me to, put some of the slides together as I try to increase awareness in Jamaica, but staying true to the mandate of the profession in Jamaica. So God bless you, and I hope you were so changed and so empowered after this presentation.
Thank you very much, Dr. Finnegan Bailey. You have been given a mouthful of oral health solution. So we're expecting that you'll be taking better care of your dental health.
That's
Dr.
right.
Finnegan Bailey, we thank you so much for being with us today. It is a
Yes.
pleasure having you. But if one of our viewers would like to find you, where can they locate you?
Oh, that's a very good question. Okay. So I work privately at Portmore Smiles Dental Care. We are on the website. We're on the yellow pages, but it's located across from Megamart Portmore. That's where my office is located. Our numbers are 876-782-6914 or 876-939-7468. And if you want to ask me a question personally, you can send me an email to ShawnetFinnegan@yahoo.com. So that's ShawnetFinnegan, ShawnetFinnegan@yahoo.com. I'll be happy to answer any question. And the beauty of emails, they can be answered at any time. They can be accessed at any time. So feel free to send me a question or anything, a thought, anything you want to share.
Thank you very much. Please visit her. I'm sure you'll be in good hands. She'll take very good care of you. Thank you,
Yes.
Dr. Finnegan, for being with us. God bless you. See you guys next time.
Yes.
Same time, same place.
Okay. Bless you.